Anyone can tell you prescription drugs are often very expensive. What's less clear is why and how it is that one kind of medication can sell for very different prices. Consumer and healthcare advocates are calling for more help with the cost controls and transparency. To talk about the effort are the Legislative Director of MASSPIRG, Deirdre Cummings, and the Co-Director of Policy and Government Relations at Healthcare for All, Alyssa Vangeli. Thank you both for being with us.
Thank you.
I want to start with Deirdre, because at MASSPIRG you did some studying on the kind of medications that are out there and the different costs. I mean, how much variance are you finding out there?
Well, what we found was shocking, even to me. After we got the test results back, I said, wait, this can't be right. I'm going to do it myself. But what we did is we surveyed 250 pharmacies across the country, 11 states, 33 communities, including Boston, Worcester, and Greenfield. And what we found was the average price spread between the typical or the mean price of drugs compared to what the cheapest one offered was on average 900% higher. Can you imagine that, going to buy a car and right next door another car would be selling for 900% higher than what you found in this place? So what we found was the price spread was just out of control, an indication that something was wrong. But we found a few other things. One is that we found that smaller drugstores had better prices overall than the larger drugstores. And the larger drugstores have that leverage to be able to buy in bulk and to be able to use that leverage to lower the price. But that was not happening in this situation. We also found that brand name drugs, while sometimes they can save consumers money, they really haven't. When we got a generic onto the market, they didn't really drop their prices, which was the promise of, let's get generics on. So put all together, we found there's a lot of problems with the way we price medications, just the huge swings in those prices.
Alyssa, what about the effect on consumers? What do you see from Healthcare for All?
Sure. So from Healthcare for All's perspective, the issue of high prescription drug costs and rising prescription drug costs is very problematic for consumers. We operate a helpline which speaks to consumers across the state on a daily basis, and we hear time and time again of people struggling to pay for their prescription drugs. So they're having trouble filling their drugs as needed on a monthly basis. They're skimping or rationing drugs because of cost. They're choosing to pay for prescription drugs, choosing between that and paying for groceries or paying bills at home. So we know it's an issue that's impacting consumers and families across the state. We also know from state data that pharmaceutical spending is one of the leading factors in overall healthcare cost growth in the state.
Deirdre, you think that for some people, if you switch from a brand name to a generic, the cost goes way down and everything's fine. But why isn't it as easy as that?
Well, we think that the whole marketing program and the way that prescription drugs are developed and then sold is broken. And we have been working to try to fix that. I mean, when people have come up to me after this report release and said, well, what can I do? For a consumer, it affects their pocketbook. And as Alyssa said, sometimes they will skimp on their medications or not take all their medications, and that's a problem. But for a consumer, if you're looking to try to get a lower price, you really do need to call 3 or 4 different pharmacies to see if you can get that price down. And there is significant savings. I mean, if you just look at some of the drug prices, there's a generic of Lipitor, which is a cholesterol drug. We found in Massachusetts, so this is Massachusetts data, the price went from $9 a month all the way up to $112 a month. It just doesn't make sense. We need to get under the hood here and find out what is going on with the pricing of drugs and how are we going to bring down that overall cost.
Alyssa, is there a significant quality difference between a brand name and the generic, or maybe is this about patients and even maybe physicians getting brainwashed by marketing?
We think that marketing certainly has a significant role here to play, and we don't know sort of the full scope of that role. But part of what we want to understand is how much drug companies are spending on marketing and advertising, and how much of that is spent on that versus other pieces of the innovation that goes into producing new drugs. So I think that for some individuals, a generic will work equally as well as a brand name drug, or another drug will work equally as well. For others, they may need the brand name drug, but certainly when generics are available and seem to be working just as well, we think that individuals should have the knowledge and the ability to pay less for something that's equally as effective.
Deirdre, what about these cases when a generic drug can be sold and yet there isn't enough competition in the market to bring the price down? I mean, why is that happening?
Well, the market's broken, and it is and that's what we're trying to get at with this mechanism. The consumers and people who purchase drugs really have no clout in that marketplace. So in a typical marketplace, there would be some give and take. There would be two drugs on the shelf. You would be able to compare the price. People would know them, and then that market force would at least bring the prices together. But in this situation, we get prescribed a medication. Nobody knows what the cost is. The physician doesn't know what the cost is. You walk into the drugstore, they don't tell you the cost, and it's not next to other compared items. So this is where we really need good common sense regulation to bring some fairness into that market.
This has been a news, and we're talking with Deirdre Cummings from MASSPIRG and Alyssa Vangeli from Healthcare for All. Alyssa, speaking of fairness, what we often hear from the pharmaceutical companies is that they put a lot of money up front into research and product development, and that's got to be covered. So, I mean, isn't that true?
Absolutely, and we certainly recognize the need to invest in innovation and resource and development, and we think that both can happen. We think that that investment can happen and drugs can be priced at a point that's affordable for consumers, because to be, perfectly straightforward, drugs don't work if people can't afford them. And so from our perspective, if a drug is priced at a fair price and more individuals are able to purchase that drug, they're going to be sold at a higher volume, and drug manufacturers will still be able to make the resources that they need to then reinvest in new drugs.
Another thing I think we need more of in the future is a user-friendly way for the patients or consumers to filter out the information. What would you like to see along those lines?
Well, absolutely. I mean, we should have better access to very non-biased comparative information, both for physicians who are writing prescriptions. So, instead of being bombarded by the industry information about that drug, they should just get information that's not tainted by marketing. And so if we all had better access to comparative information, we would all be better off, and I don't think we would be spending as much money as we do on some of these really high-priced drugs.
Alyssa, I know you mentioned the burdens for people who actually need the medications, but I guess a lot of that cost is pooled, so really, I guess all of us pay it, don't we?
For the cost of medication, yeah,
yes.
We do, but I would say that there are disproportionate burdens on certain individuals, and so that's where the real problem is, when people can't afford a high copay, a high out-of-pocket cost, high coinsurance, and they're continuing to struggle to make those payments.
Deirdre, what about changes in legislation? Anything that you'd like to see coming out of this?
Well, there's been a fantastic bill that's filed by Senator Lewis and Representative Barber that really gets at getting under the hood, so to speak, of what's going on in the prescription drug industry, and really having them come to the table. Like every other part in our healthcare sector, they have to keep to benchmarks. They can't increase costs too much over time, and they have to present themselves and make their case. The prescription drug industry hasn't been part of that. They need to be involved in that. As we have to pay more for drugs, it increases the cost of health insurance, and it also increases the cost that the state has to pay for health insurance. So this bill, and Alyssa can talk to it more specifically, but brings them to the table so that we can investigate and find out what's going on here.
And Alyssa, what is it in this bill you think would be so promising to help
Sure.
people?
So the bill has a number of different components. So I'll go over them somewhat quickly. The first component is that it requires pharmaceutical companies to disclose more information about how they're pricing drugs, why drug prices are increasing, how much they're spending on marketing and research and development, so that both policymakers and the public can understand understand better what's happening and why drug prices are increasing. It also gives an agency called the Health Policy Commission the authority to set what we're calling an upper payment limit on excessively or unreasonably priced drugs, which would be the maximum amount that any payer in the state could pay for a specific prescription drug. So it starts with transparency, which we think is critically important, and moves beyond that to actually have some accountability around how drugs are being priced, which will then translate into lower out-of-pocket costs for consumers and businesses and the state.
So finally, I should have you mention one more time how people can get more information from Healthcare for All, especially about medications.
Absolutely. So on our website, which is www.hcfama.org, we have resources about this proposed legislation, and we also have an opportunity for people to share their stories with us about struggling to afford prescription drugs, and we'd welcome that information as well.
And Deirdre, I know you get lots of information and probably a link to this report at MASSPIRG.
Yes, we absolutely do, and that's at MASSPIRG, MASSPIRG.org.
Thank you both, Deirdre Cummings and Alyssa Vangeli.